Securities offered through Cambridge Investment Research Incorporated, a broker-dealer, member FINRA, SIPC. Advisory services through Cambridge Investment Research Advisors Incorporated, a registered investment advisor. Cambridge and Clear Vista Financial are not affiliated. Discussions in the show should not be construed as specific recommendations or investment advice. Always consult with your investment professional before making important investment decisions.
Welcome, everyone, to the Spend Life Well show. I'm Certified Kingdom Advisor Mark Trice. This show is about looking at your financial life from a biblical worldview. I'm joined here in the studio today by fellow financial professional Jesse Hamilton. Hey, Jesse.
Hey, everybody. Welcome to the show.
So it's that time of year again when we hear all those Medicare ads.
Yep.
In fact, if you're turning 65 or over the age of 65, your mailbox has probably already been stuffed with all sorts of advertisements wanting you to sign up for Medicare Advantage or Medicare Supplemental.
All over TV as well, especially later at night.
And there's so much misinformation.
Yeah.
I can say misinformation. I know we're in the middle of an election season, but I can say misinformation because...
I might fact check you, Mark.
Yeah, please do. Please check me. A lot of people are given the incorrect information about different types of Medicare. So we're going to kind of break down original Medicare versus Medicare Advantage. Medicare Advantage is the one that you hear the most about during an open enrollment period because it's the one that insurers want you to sign up for because it's the one that puts them on the hook the least. Mm-hmm. It also tends to be cheaper, but what a lot of people don't realize is it can be a big mistake depending on your personal situation.
Yeah, so the difference here is going to affect both quality and cost of the healthcare now and in the future for those of you who are in that time frame.
So the most important decision you have to make with Medicare is when you're going to apply, right?
Yes.
If unless you are covered by a large group employer plan, that's more than 20 employees in the plan, you're required to sign up for Medicare at age 65.
But they tell you that you have to no matter what.
You have to no matter what. And a lot of people waste money by signing up too early if they're continuing to work and they're covered by their workplace plan or their spouse's workplace plan.
Yep. It's one form. We have it here in our office. We can prove to you that that's right.
And make sure, if you're not sure, check with your HR department to see if that they're considered a large group employer. If some of you are working for a large hospital, like a lot of our clients are, that's a large group employer.
Very much so.
You're exempt from signing up for Medicare at age 65 as long as you're still covered by that plan. So anyway, that's the first and most important decision is when. The second most important decision to make concerning Medicare is how they want to get their care, okay? And so deciding between original Medicare plus a supplemental plan and Medicare Advantage can affect both the quality and the cost of healthcare they receive now and in the future.
Right.
So let's kind of define what is original Medicare because a lot of people don't understand that. Simply, original Medicare is health insurance funded by the U.S. government.
Mm-hmm. The classic health insurance models where the insured pays the monthly premium taken out of their Social Security
This year
check.
it's what, $174.10?
That's right. And then when a medical bill is incurred, the patient pays an annual deductible plus 20% of the bill. Government pays the rest.
Okay, sounds pretty easy, right?
Simple, clear cut.
Except it's not.
It's not.
So the insured, that's you, if you're on Medicare, has complete freedom and control over how and where to get their health care. And most providers accept Medicare because it covers so much of the population. Now, private insurance has really evolved over the years. Policies were originally designed to cover mainly prescription drugs. Okay?
Drugs are Part D of this, right?
Part D was instituted in 2006, and an official public-private partnership established specifically for drug coverage where private insurance companies offer various prescription drug plans with both the insurers and the federal government bearing the cost. All right?
Makes sense.
So Medigap policies remain viable, however, because covering some of the key costs but not covered by Medicare, mainly Part A deductible and the Part B co-insurance. So you've got the supplemental insurance that you can purchase to help with some of that deductible and co-insurance that original Medicare doesn't cover. Let's talk about Medicare Advantage because it's the most heavily dominated marketing approach. It's very aggressive, and people try to make it sound like that's the best way to get your Medicare. And it may be for you. So originally, Medicare Plus Choice is what it was called. It was kicked off by the Balanced Budget Act of 1997, and I think that was the last time the budget was balanced, was 1997. But here's how it's different. The government pays private insurers an annual rate, which is theoretically equal to the cost to insure a person under original Medicare. In exchange, the insurer promises to deliver all care under Parts A and B. This was deemed at the time a cost-cutting and risk mitigation effort by the federal government. Expanded private health insurers' involvement in Medicare and now encompass the delivery of care, not just the payment of the bills submitted by the providers. So how do you decide, Jesse, which is right for you, original Medicare plus a supplemental plan or Medicare Advantage?
It depends on if your main concern here is high quality care and you're willing to pay higher premiums for the assurance of knowing that care. Go with original Medicare.
Okay.
And if your main concern here is cost, you're willing to accept an insurer's assessment of what you need and the way that care should go, Medicare Advantage might be better. Understand that if your health worsens and you do need care, your costs could end up being higher. So a little more risk here.
A little more risk with that, but it's one of the cheapest monthly premiums. Some premiums are even zero.
Yeah.
And they make it sound really enticing. But once you're on Medicare Advantage, it may be very difficult to sign up for original Medicare plus a supplemental plan, depending on your health. And that's usually when people think about it is, oh gosh, my health gone downhill. I need to get more coverage. And you may not be eligible for that type of coverage under original Medicare and a supplemental plan.
So does that mean if you're in really great health and you don't really care, then Advantage is your way to go?
Not necessarily. Not necessarily, because there's lots of other factors that come into play. Mm-hmm. Medicare Advantage plans may offer additional benefits and lower premiums, right? But they also place restrictions on care, all right? Patients must choose a provider within the plan's network, and many services and procedures must be authorized beforehand, and they can even be denied.
So a few more hoops to jump through, and you have to be in network.
That's right. So if your priority is on saving money, and you're in good health and you have low prescription drug needs, then maybe Medicare Advantage is the issue. But will you always be in that situation? We cannot predict the future.
Probably not. You're not just going to be in perfect health and then pass away quietly.
If you're in fair health but you need more medications, maybe a Medicare supplemental plan is the right one for you. You'll have to contact a well-versed insurance agent. We have ones here in Waco and Temple and Austin that we can introduce you to. They're very thorough.
This is a specialty, though. This is not just your average corner insurance
This is not
agent.
going down to the car insurance guy and asking for Medicare help. This is something that's a specialty. There are special licenses. We don't even have them because it's so complex.
Yes.
And so we refer people to specialists that understand Medicare coverage and can help you with those things. So if your priority is on the healthcare experience, in other words, being able to go to the doctors you want to, getting the procedures that you want to, perhaps a Medicare supplemental plan is right for you.
With possibly higher premiums?
Yes, you do. You're going to pay higher premiums, but you'll have more coverage for different things. And one thing that a lot of people, what's usually one of the big items on the bucket list for a new retiree?
To travel.
To travel, right. And with Medicare Advantage, one of the things that Jesse said just a minute ago was that your doctor and your healthcare must be in network, which could be for that particular health insurer, could be Temple, Texas.
Yeah.
Or Central Texas.
So what if you have an emergency in Boston or in London or...
You may be paying a lot of that out of pocket.
Okay.
Now with a Medicare supplemental plan, we're thinking specifically Plan G, a lot of that would be covered because your co-insurance and your deductibles will be helped out by that supplemental plan.
Or maybe you're on your African safari. That's popular.
That's right. That is. We see a lot of people
taking
cruises, mountain climbing, skydiving. These are all fun things that retirees do. Skydiving is not on my bucket list. But so just to wrap it up, folks, know that when you do sign up for Medicare after 65, your Medicare decision could be very binding, right? You might not be able to switch from one form of Medicare to the other if you're not happy with your plan or if your healthcare needs change.
Yes.
Most states have the Medigap open enrollment period. If you don't buy a Medigap policy within 6 months of enrolling in Part B, you'll be subjected to underwriting, and you could be denied. So it's important that you know the windows. Now, the earliest that you can sign up for Medicare, Part A and B, is 3 months before your 65th birthday. That's the earliest, okay? That is not a deadline of 3 months before that you must sign up. People call us all the time wanting to know, oh my gosh, I'm 89 days from my birthday, I screwed up. No, that's just the earliest you can sign up. You can also sign up the month of your 65th birthday, and you can sign up in the 3 months following your birthday month, but there are some limitations at that point. If you're working still and you retire, no longer covered by that workplace plan, you have a period of time as well to enroll. We usually guide our clients to make sure that their Medicare starts the same month they retire.
Yeah, so let's just say you're that person, you're turning 65, and you're trying to gather your information. You can come talk to us, of course.
Yes.
We're happy to give you advice on that. We can steer you towards that Medicare expert to help you make the decision. You're going to want to come with a list of your prescription drugs, major health concerns, and maybe some of your retirement goals. This is one critical but small piece of your overall retirement plan. That's how Mark and I come into play.
So we encourage you to talk with your financial advisor about what you're intending to do in retirement, because that can steer you in the path of what type of Medicare coverage you might want. You know, if you start with a Medicare Advantage plan, thinking that's the cheapest right now, with the intent of switching later on to original Medicare, it may not work anymore.
It can be difficult,
Yeah.
especially if you have some conditions come up.
That's right. And so that's when most people think about it, is when they have a condition or a cancer or something pop up.
Yeah.
And it may be impossible to get on to original Medicare, which would provide you with better coverage. So anyway, folks, I know this is a complex issue. We encourage you to talk to a financial advisor. Talk to an expert in Medicare. Do not call up the sales desk at the local insurance company, because they're going to try to sell you a policy. You need to make sure that you're making decisions which are right for you and your family as you go into retirement. This is a fun time. Healthcare should be one of the easy parts of this, but it can be a challenging decision. So we encourage you to reach out to someone.
That's right.
Until next time, folks, you've been listening to the Spend Life Well Show. Hey, give us a like on the YouTube channel or different places that you're listening. And you can always text us at 254-282-0495 and send us your ideas for future podcasts. And also, if you've got just general questions about things, we'll be glad to get back with you and answer those questions.
I hope you learned something today. A select few people listening this is all they care about. And the rest of you probably don't even care at all, but it's educational.
You will someday.
You will someday.
All right, folks, have a wonderful week. We'll talk to you soon next time on the Spend Life Well Show.